So it's an honor for Kevin and I to be presenting to you today at this Aspetar online forum session on nutrition and hydration, specifically for the modern athlete. And our presentation focus for you today is going to be actually more of a presentation discussion, all about nutrition for injury, and in particular a look at the evidence with a view to how it applies to practice in the real world setup. So just to give you a quick bit of background to this, what we're talking about here is exercise-induced injuries, which are common not only to recreational athletes, but of course to elite level athletes. And about half of those injuries can be considered really quite severe, leading up to a lot of time off training or competition, as much as 3 or more weeks. And Kev, there's more to it than that, though, isn't there?
All right. So for this particular presentation, what we're going to focus on are the injuries that result in immobilization of a limb, or at least injury severe enough that the athlete or exerciser is inactive, their activity level goes down, and that will result in a loss of muscle and muscle function, as well as muscle mass, and also other tissues will be involved, tendon and bone, etc. So that's what we're going to focus on mostly today.
Now, of course, we're talking about injuries, and specifically exercise-induced injuries. And the nature of an injury is that it presents a wide variety of problems to the athlete. And of course, there's a wide variety of potential solutions, including medical solutions, physical therapy, rehabilitative solutions. But these solutions can include nutrition. And that's why we're excited to be talking about this today, because there is now evidence, it's emerging, and we're going to address that, on why giving special attention to nutrition whilst your athlete is injured can actually support this process of wound healing, because we want that athlete to be able to get back to training. We want them to be able to get back to play, back to their events and competition, because if they don't do that, it isn't just impactful in a not great way to the athlete. It also, of course, affects the team. The goals of that team are going to be affected by this. So the research that we're referring to, a lot of this comes back to the review that was written by Professor Tipton, who's going to be talking to us over the next 10 minutes or so about what we know, maybe some emerging areas, and ultimately what the key recommendations and considerations are on this topic. So I guess at the beginning of this, Kev, of all the things that we know, which isn't a lot, and we're going to explore that in today's session, but the most important area is going to be energy balance. Now, that's easy for me to say, but maybe you can help us understand why energy balance is so critical to this process.
Sure. So in general, if we broaden it out a bit, then any kind of deficiency is going to be bad. So deficiency of micronutrients or macronutrients, and in this case, we're talking about energy. So just overall energy needs to be sufficient. So typically what's going to happen is a lot of people, if you talk to them, what their initial response is going to be, hey, I'm not moving around as much. My limb is in a cast, my leg is in a cast, or my arm's in a cast, or whatever, or I'm lying around because I'm sore. I'm not as active. I'm going to eat less. And that's a natural reaction and makes sense. But you got to be careful about that, because if you drop that energy too much and you get into an energy deficit, then you're going to, as it says there, slow wound healing and increase the loss of muscle that's going to happen. Muscle protein synthesis is decreased in an energy deficit. And also, your muscle doesn't respond as well to the anabolic stimulation from protein intake, what we call anabolic resistance. So you sort of get a double whammy, and that exacerbates muscle loss if you're in an energy deficit. Now you say, well, why would you be in an energy deficit? One of the problems is that wound healing itself and just the response to a wound or an injury is going to have an increase in energy expenditure. And so you might be sort of overestimating how much energy underestimating how much is being expended because you're not appreciating some of these other things, other factors like the wound healing. And also, if you are on crutches, expending to get to the same distance on crutches as you would be walking takes a lot more energy. So it's possible that if you're moving around a lot on crutches, you could actually energy expenditure could be higher. So the trick is to have energy balance to make sure you get enough energy. Now, the opposite is also true where you don't want too much energy, because you're going to gain fat. But even as I've heard people say that, hey, I'm just going to eat enough to make sure I'm not in an energy deficit. If I get a little bit of fat because of that, hey, no big deal. I'll train that off once I get back to full fitness. Well, the problem is that it actually exacerbates the muscle loss. Overeating does. And that's a couple of studies have suggested that, have shown that in particular, there's a bed rest study. So you don't want to have too much energy, you don't want to have too little energy. So as a practitioner, your job should be to try to monitor, try to estimate as best you can the energy expenditure and try to match that energy balance.
And that's just exactly where, we need to be thinking about this difference between our focus on this. When we talk about science, we use phrases like energy, we talk about macros, amino acids, calories, and so on. But when we're looking at this from the perspective of applying it into practice, communicating this information to real people in the real world, through the practitioner, in the club, on the pitch, and so on, we're going to want to take this from a food first perspective. And specifically, we need to understand that an effective nutritional strategy needs to be a well-balanced diet. And that's what the evidence supports. And that's why we use phrases like food first. And this is where what we're talking about is not just focusing on how many calories you're going to have, because that balanced diet needs to be consisting of a wide variety of whole foods, different colors, different sources of foods that are minimally processed, because that's what's providing the body with the vitamins, the minerals, the fiber, and the other factors that we require to be healthy, which of course athletes aren't just athletes, they're also human beings, they need to be healthy. Now this of course does lead into a number of grey areas that may be supported by performance nutrition interventions and sports supplements, and we're going to address that in a minute. But I guess the biggest area, the most popular area beyond energy balance is the topic of protein, Kev, and you're definitely the man to talk us through the role that protein has in exercise-induced injuries. So where does it fit in, and why is it an important consideration?
Yeah, it is probably at least for macronutrients, is the most important one to consider. Now, as I mentioned before, if you are immobilized or your activity level drops because you're injured, well, then protein intake, is probably going to go down. If you drop your energy expenditure, protein intake will probably go down proportionally. Now, the problem is, as I mentioned, is that protein synthesis goes down, both basally and in response to protein intake. So increased protein intake is probably important. Now, there are several studies that support this, in immobilized individuals and in bed rest, etc., seeing that higher protein intakes can protect that muscle and you don't lose as much, which means that, the bottom is not as low, and so getting back to where you need to be is easier. And so as you see there, probably recommendation of around 2 or even a little bit more, 2.2 grams per kilo body mass of protein is probably where you want to be. Now that might be difficult in some individuals if energy intake is too low. So, that's a challenge that you need to think about.
So Kevin, as you look at this screen, we can see common sources of protein such as meat, fish, eggs. Potentially there are plant sources of proteins. Are there any considerations in terms of the types of proteins, and what about the unique needs and preferences that some athletes have. And I'm thinking, of course, not just a need for more protein, and not just necessarily whether it's food-based or do they supplement, but what about the kinds of proteins and the kinds of supplements if they follow a plant-based diet, or for religious reasons they are excluding certain sources of proteins? Are there any considerations there, Kev, that we need to bear in mind with exercise-induced injuries and supporting them through nutrition?
I think those sorts of questions are much less important than the total amount of protein. If we do a reductionist look at it, then you can definitely see, if we take an individual protein, say whey protein, and we compare that to soy protein, a plant protein, then we can see differences in protein synthesis. But that happens acutely. But when we translate that to if you're going to take in 2 or 2.2 grams per kilo, then it doesn't really make that much difference. That just getting the total amount of protein is most important. And I wouldn't worry too much about the sources of protein. That even a vegan diet at that high level of protein, it's going to be tough to get that much protein probably, but it's going to be, or at least a challenge, maybe not difficult. But I would say that you focus on getting the protein in more than the protein sources. Now, when possible, of course, high quality protein, animal proteins, lean proteins, especially if you're watching your energy intake, are going to be something to consider.
So this very much fits into that phrase we are starting to hear a lot more in sport and exercise nutrition of total, then type, then timing. So what about timing? Is timing going to have any impact, or is it really still just back to the total again?
Well, timing could make a difference. It's a little bit controversial, but it seems like there's a concept called the muscle full effect. So if you keep your amino acid levels from your protein intake stay high, so if you're eating constantly and you keep those amino acids high, then protein synthesis in the muscle tends to start dropping. So, but if you let the amino acid levels in the blood go down and then come back up again, then you get a renewed stimulation of protein synthesis. So that's really what you want to do, is kind of spread your protein out a little bit throughout the day. So have it in spread out in between 2, 3, 4 hours between protein meals.
And look, supplements are always popular for one reason or another, and oftentimes there's a belief that they'll do things that perhaps they won't do. And I guess one of the real topical areas is not just about protein specifically, but the amino acids, and particularly the branched chain amino acids. And I know we've done podcasts about this, and you've written about this and ranted about this topic, but for this particular situation, is there any benefit to individual supplementation of amino acids or leucine in particular? And where I'm going with this is, generally for anyone, and maybe a specific scenario where somebody is on a special kind of diet, like a vegan or vegetarian diet.
Again, if protein intake is sufficient, if you're getting up in that 2 grams per kilo range, I really don't see any argument for having any other supplements, leucine included. You should be getting plenty of leucine in that diet to trigger it. Now, there are probably going to be people that would disagree with that, and again, you can pick out certain studies, but it's not consistent. The studies aren't consistent with this kind of thing, and certainly in this particular instance, in an injury situation, there are no data suggesting this. In theory, you can make the argument for leucine, but again, if you're getting enough protein, you should be getting enough leucine, so I wouldn't worry about it. As far as with a vegan diet or something like that, again, you're going to have people that might argue that, but at that high amount of protein, you should be getting enough leucine even in a vegan diet. I would think.
That's great. So again, that just reinforces that the approach is very much about a food first approach that we've been advocating. Now,
can I just say one other thing? You could argue that if there's a smaller individual, say, who their energy expenditure is low, so energy balance is low, that 2 grams per kilo is going to be a big chunk of their energy intake, but still it might not be that much total protein. And then there might be an argument for leucine, but I would say that's going to be very rare.
Okay. So Kev, you've pretty much made a case for there being no case for amino acid supplementation as long as they're getting enough protein. But when we look at the evidence, the data out there, there is a couple of supplements, they're very popular supplements, that may potentially have some benefit in certain contexts. What are your perspectives on creatine and omega-3s, which obviously are on the screen right now?
Okay, so if we think about recovery from an injury in sort of two phases, the first phase is when that limb is immobilized or the athlete is inactive. So then muscle is being lost during that phase. And then you get the time when you start rehab and gaining muscle back to try to get back up to full fitness. So if we look at the first phase, when muscle is being lost, creatine, it's controversial. There are studies on both sides. But my take on it would be I wouldn't mess with creatine during that time because it's not clear that that's going to be advantageous. On the other hand, as in any other type of place or any situation where you're wanting to gain muscle, when you're in that rehab recovery situation, then creatine will be effective as it does in sort of normal hypertrophy. It's sort of the opposite with the omega-3 fatty acids. There is evidence in animal studies for sure, and some in humans that suggest that omega-3 fatty acids can ameliorate that muscle loss during that inactivity and immobility phase. Now, the catch is that it looks like the mechanism is not due to this anti-inflammatory property of the omega-3 fatty acids, but instead it's the incorporation of the omega-3 fatty acids into the muscle cell membrane and maybe even into the mitochondrial membrane. And so that takes a while. It takes at least 3 or 4 weeks before that becomes effective. At least so far, that's the evidence that we have now. It might be shorter, and we need to look into that, but we don't know. So if that's the case, then if you get injured and then start taking omega-3 fatty acids, it might not do you much good because by the time you start getting any impact from those omega-3 fatty acids, you're already getting ready to start into your recovery phase. Now, the evidence so far looks like omega-3 fatty acids in a hypertrophy situation, like in the recovery and rehab phase, aren't effective, so they're no good. So the one time you might think about omega-3 fatty acids is if an athlete knows that they have surgery scheduled at a certain point, down the road, and they can start taking the omega-3s 3 or 4 weeks ahead of time, then maybe that will help while they're recovering from the surgery to ameliorate the muscle loss after the surgery.
Well, there you have it. I mean, there's a lot to this, and of course, there's a lot more to be learned about what is actually the best nutritional strategy to support or enhance recovery from exercise-induced injuries. And of course, we'll look forward to seeing that evidence as it comes in. But for now, if we take the keys from what's being discussed today, and of course the evidence that exists on this, deficiencies, particularly those of energy, protein, and the micronutrients, by following a balanced diet is really what we need to focus on as we keep driving home this concept of a food first approach. We need to be careful about the unique needs and preferences of each individual athlete, their training needs, their religious needs potentially, their personal needs, and of course where they are in their phase of training, and as we've mentioned, as it may relate to their return to play or their return to training or whatever. But fundamentally, the ultimate recommendation here is going to be first do no harm. So you need to assess the need, assess the risk, and then assess the consequences before you start to give advice and recommendations of this sort. You're going to want to read more about this. Kevin's paper here is pretty much the first port of call. There may be some more work coming out soon on this, but this is a great place to start. It's open access. Kev and I have done an hour or so conversation specifically on this topic in one of my podcasts here, episode 110. We've also done a couple of podcasts recently on exercise-induced muscle damage with Dr. Daniel Owens, and Kev and I talked about muscle protein breakdown in this other podcast you can see here, if you really want to take a deep dive into this topic. But do come check out everything that we do at the IOPN, the Institute of Performance Nutrition, our online diploma in performance nutrition. And with Kev on board as our Director of Science and Research, you can be looking forward to our growing research projects that we look forward to bringing out in the coming months and years. So, Kev, we've done it. Thank you for listening, everyone.